Good morning, beautiful people. Happy hump day. Carly here, Dr. G of Empowered Pelvic Health, concierge pelvic floor physical therapy in Bergen County, New Jersey. Today, I am chatting with Dr. Jesse Cease, Dr. Seuss of Waldwick Family Chiropractic. He's a chiropractor. He's the owner. And we're chatting about all things pregnancy, postpartum, how pelvic floor PT and chiropractic can really help our mamas during these, beautiful times during their lives, pregnancy, postpartum. There he goes. Let's see. Increase pain for these mamas and maximize their function. So he's coming on. One sec. Hey, Jesse.
I'm here.
You're here. We did it.
What's
How
up,
are
guys?
you?
I'm doing well. How you doing, Carly?
I'm good. Go ahead. Introduce yourself.
Well, so I'm Dr. Jesse Cease of Waldwick Family Chiropractic. I heard your introduction. It was perfect.
Yeah.
Yeah.
Good.
Dr. Cease, Dr. Seuss, whatever you want to roll with.
I just love Dr. Seuss. I just can't shake it.
How could you not? Yeah.
Exactly.
You'll never forget that chiropractor's name. That's what I tell all my patients. You'll never be like, what was the name of that chiropractor?
That's right. That's right. And personally, if you don't mind sharing, you and your beautiful wife are expecting.
Yes, our second baby, yes.
So both professionally and personally, like, you have a lot of experience in this arena. So
yeah.
definitely interested to pick your brain today. So you see a lot of pregnant and postpartum, throughout the entire first trimester, second trimester, third trimester. He did a great series on his Instagram. Check it out.
And YouTube, yeah.
Yeah, and YouTube. So what are you really, mostly seeing them for? Like, what is the primary complaints or, sources of pain?
So it's funny with the pregnancy thing. I think it just kind of started happening organically. It's not something I kind of searched out, right? Like I wasn't trying to be like the pregnancy chiropractor. I think it was just like the age demographic of kind of like my patient base is around our age, and we're kind of at that stage now. Like maybe 5 years ago, we were at a wedding every other weekend. Yeah. Now everyone's having a baby so it's just like
every other weekend.
Right? Yeah, exactly. So it just kind of started with like my current patients started, hey, I'm pregnant. Is chiropractic safe during pregnancy? Should I come back after pregnancy? And it's just it kind of took on legs of its own. It's been really fun. They're probably my most favorite cases to oversee, I think.
100%.
Yeah, and so kind of to go back to your question, just as far as frequency of care and whatnot, we usually don't see moms like in the first trimester because they're not really in pain just yet. They don't really have a belly unless they're already established patients. So kind of like the idea behind, why we want to see chiropractors during pregnancy is the same reason we want to see chiropractor not during pregnancy, and that's just to restore proper mobility to the joints. And with pregnancy, we will focus like on the pelvis and the sacrum.
Right. And we were chatting about, because I love PSAs. I love public service announcements. I love debunking any myths. So it was hammered to us in physical therapy school that we don't mobilize through joints that move too much, hypermobile segments, right? Mm-hmm. So in my brain, I'm like, I know these mamas have, and actually I was surprised to find out it's most prevalent in the first trimester. They have relaxation circulating through the body.
Interesting. Yeah.
Right? I know. I was like, oh, this is like a second, third trimester thing. No,
yeah, it makes sense though when you think about it, right?
Absolutely.
Yeah, because the body's kind of preparing to move.
Yeah.
And whatnot.
Yeah. So relaxin's a hormone that's circulating throughout the body. And it's really, it does exactly what it sounds like it does. It relaxes these soft tissues. So your ligaments, any connective tissue is lengthening and is relaxing to expand that pelvic girdle and to make room for baby and to also prepare for childbirth. So to hear that we're like adjusting moms, like I was super interested on your take on this and, why it's safe and why it's so important.
Sure. Yeah, so we never adjust through a hypermobile joint, right? So the idea behind an adjustment is to restore proper mobility to the spine or the pelvis or the sacrum or the specific joint we're working on. So we never adjust through the hypermobile joint. What we do try to find are fixations in the pelvis and the sacrum, and we kind of use that relaxant as a tool for the adjustment. So a lot of times with my pregnant patients, the amount of force that's required to accomplish the adjustment is significantly less than the amount of force than my non-pregnant patients. Does that make sense?
No, absolutely. That's so
we kind of use it as a tool to make the adjustment move a little easier, right? So
Yeah.
it's definitely beneficial, I think, to mom. And like you said, exactly like you said, the relaxin, the job of the relaxin is to expand that pelvis and the sacrum. Now, if there's any underlying fixations that makes that progress more difficult, the body's kind of working against itself. So I always say any good chiropractor will tell you that we don't do any healing in our office. We just put the body in the best position to heal itself. And we do that by removing those fixations.
Yeah, but when you're aligned and when everything is in the appropriate place and you're able to move and maybe not waddle so much because that tailbone pain or the low back pain is so prevalent, it does make such a huge difference. So you are a healer, okay?
Well, we're a healer. Don't get me wrong. I never said we
Yeah.
were a healer, but we don't do any healing. We just put the body in the best position to heal itself. So we're removing those restrictions that maybe from sitting, hunched over your laptop for all this time, or crossing your leg over one side. All those things add up over time, and it causes these biomechanical fixations that can present as a problem when, as I say to my mom, when game day comes.
Absolutely, game day. I love it.
Yeah.
So tell me, because I think a lot of my mamas would be curious. Like, we have mama coming into your office, to check her alignment and for treatment. Where can she lay? Like, how can she be positioned?
Sure. So I think it really depends when the first treatment is. If it's trimester 1, there's really no contraindications to laying prone. But once
being
the mom
on their belly.
Yeah. Oh, sorry. Yeah. Laying on your belly. There's no contraindications to laying on your belly. But as the belly starts to grow, that might present a problem. Our table actually has what's called a breakaway thoracic piece. The thoracic piece is the part that you lay on, like with your stomach. So as you kind of grow, we'll just drop that down a little further. And actually, most moms will be like, "Oh my God, this is wonderful. Like, I haven't laid on my stomach in 5-6 months."
Yeah, I know.
So just leave me here. So
you're like, it's been 45 minutes. It's time.
Yeah, it's time to get up.
It's comfortable, right? To offset the weight of the back, get them against gravity, give them a break from holding baby. Once they're showing they're getting a little bit bigger. Absolutely.
Yeah.
One thing I love to talk about that I know you're very comfortable treating is round ligament pain. So can you talk about what it feels like, what it presents like, and how we treat it, how we, make it feel better?
Sure. So this is definitely your expertise, but I'll give you my my experience with it. All right. So it started. My wife actually had a good degree of round ligament pain when she was pregnant with our first daughter a couple years back. Actually, to even precede that, now that I think about it, the first pregnancy I saw through was my cousin Jamie. I don't know if she's watching this, but she came to me because her baby was breached, and I was like right out of school, and she said, listen, I read online chiropractic can help with breech babies, and I'm like, whoa, like slow your roll here, like I'm not flipping any babies.
Okay, let's
exactly.
not get crazy. Yeah.
So I said, there's this one technique we learned in school about how round ligament tension can kind of decrease the space in the uterus for the baby to kind of make the turns that they want to make. So we're like, yeah, let's give it a shot. So it's a very gentle technique. The baby's the mom's kind of laying on her back, and it's just like a very gentle hold of the round ligament, which is like kind of in between the belly button and the front pocket. Is that a good anatomical?
No, absolutely.
Yeah. So very gentle pressure to that area. And sure enough, Jamie came back the next day, and she's like, the baby flipped. And I'm like, well, listen, I think you're giving me way too much credit here. I don't think I'm responsible for that, but it was pretty cool to see that for sure. So I don't know if I aided in that or whatnot. But then to fast forward to my wife's pregnancy, there was no breach situation, but there was a good degree of round ligament pain. And if any moms have ever experienced that, it's not very comfortable. It's a pain that kind of starts, from what I understand, I've never experienced that either, but from what I understand, it's a pain that kind of starts around your belly button and heads down, into the groin and into the crotch region. So, and like sitting is uncomfortable. Walking is uncomfortable. So it's just like, not a fun situation. A lot of times moms have no idea what to do because you can't apply heat to the belly, right? Like,
right, of course.
there's really, you can't take Advil to help. So they're kind of like at a loss of what to do. And it's just a very gentle, like, manual contact that we use in order to kind of help alleviate that. And a lot of times it'll give mom some relief from that discomfort.
Yeah. So if anyone who's watching doesn't know, breech means that baby is feet down. And that's not how we want to deliver. We want head down.
Head down.
What happens is the round ligament attaches to the uterus into the pubic bone, and it like anchors down the uterus. But of course, uterus is expanding, baby's getting bigger, and just like Dr. C said, it can cause a lot of that like groin pain, that crotch pain, like sometimes can mimic like pubic symphysis. So I'm sorry, I have to bust it out. So like,
please do. Oh yeah.
Around, I love it. This is Patricia the pelvis. So anywhere right into here. And really, it can be super uncomfortable with any transitional movement, pivoting, turning, stairs, curbs. And, this is a tool that we love in physical therapy world, especially pelvic PT world as well, because if we can loosen up that ligament and give the uterus more wiggle room, okay, and baby has more room to move, of course, baby can flip and get in the proper position. So absolutely. That's an awesome technique and super, super important. I love it.
It's just another tool in our toolbox. It's not something that we, promote but if you're having that, it's something that we may be able to help. And we may, that technique, it might be a little bit more involved in that, but it's just something that we have in our toolbox for sure.
Of course. So Jesse was talking about mobilizing, segments that are a little tight or a little bit stuck, right? What I think of mostly, the rule of the spine, if we're losing or we have too much motion at one part, it's almost like another part of the train tracks has to make up for it, right? Yeah. I think what I find commonly, and we were talking about this, is thoracic pain. So in between your shoulder blades, kind of like where the bra strap is. So it can happen for a lot of different reasons, right? Maybe the breasts are getting bigger. We have more pressure going forward. In the postpartum phase, I'm going to let you take this one away. What do you call it in the postpartum period for like shoulder and back pain?
Well, this is supposed to be a potential name of your business. I didn't come up with it. It's the fourth trimester.
Oh,
right?
Yeah.
Is that what you're talking about?
No, like mom's shoulder.
Oh, mommy's shoulder. Yeah.
Mommy's shoulder, of course.
I thought you were talking about the fourth trimester.
No, but thank you.
Yeah.
I was like, that's all you. So
mommy's shoulder is something that we deal with very frequently. So just to kind of proceed this conversation, like, once mom gives birth, so we're going to see them throughout pregnancy. Once she gives birth, we have her follow up 6 weeks after, giving birth. And the main goal of that, well, once they get cleared from their OBGYN to kind of resume working out and doing the, living their life, back to normal, we want them to come in and kind of use that relaxant that's still in their system to kind of help get us back to that pre-pregnancy state. Use it, like I said, use it as a tool. So a lot of times we'll be evaluating that, and I'd say 9 out of 10 times mom's like, my low back feels great, but oh man, my neck, my shoulder, I have no idea what happened. Maybe I slept wrong. And I'm like, no, maybe you've been holding a baby like this for 12 hours a day for the past 6 weeks. Like maybe that has something to do with it.
Rocking the baby, holding the baby, breastfeeding the baby, right? So what happens, and like seriously, first time moms especially, you're so in love with your baby. This is the cutest thing you've ever seen. All you can do is look like this. So what's happening when I'm looking down like this? The one side trap is just straight up locked. The other side's over lengthened, and you like find yourself in this position. It's tough. The pecs are getting tight, the muscles in front of the chest, the trap, like I said, and then that upper back is doing a lot of the work.
Sure.
Of course. So you find that these segments are tight, and maybe just like mobilizing, whether it's a manipulation
so
or
we
mobilizing
usually
that thoracic
see
spine.
Yeah, we usually see a lot of fixation in the upper part of the rib cage on whatever side that they usually hold the baby on. So like upper, if they're like right-handed feeders, right, we'll see like upper right rib cage rotation. And what that does is the shoulder blade or the scapula sits on that rib cage. So if there's any rotation on that, then that shoulder blade, that scapula needs to kind of glide on that rib cage. If it's pushed back a little bit, makes that a little bit more difficult. And then these joints of the shoulder kind of have to take up, like you said, the train track analogy that you used, have to take up that, extra mobility.
Absolutely. I almost totally left this out. Can you talk about, because this is so common and I feel like it's tricky to treat. This is where I would like send my mama to you immediately. Rib pain is so common during pregnancy.
So common, yeah.
Let's get into it. Why
Let's
is this
talk about
happening?
it.
Exactly. So they call it the rib flare. The
Uh-huh.
rib, I mean, we have to make space for baby. Those bottom ribs have to flare out. I think it's like 10, 17 degrees, give or take. Everyone's very individual. Baby's taking up space in the abdomen. Your diaphragm, your breathing muscle that sits underneath the rib cage, doesn't have anywhere to go. So we start breathing with those accessory muscles up here just because we have to. It's very common for these mamas to develop different breathing patterns that then can carry over into postpartum. But how do we treat rib pain during pregnancy to give them a breather? But
Sure, yeah. I see what you did there. So rib pain is something that we deal with in our practice, pregnancy or not. It's very common because of the dysfunctional breathing patterns that you talked about. Mom's at a disadvantage because it's not something that they really have a choice, right? Like they have to breathe with these accessory breathing muscles, especially later in pregnancy. So there's these joints so the rib cage, the ribs themselves attached on the chest in the sternum, and it's not very mobile at that part, that articulation, that joint is not a very mobile joint. In the back, the ribs also attach to the thoracic vertebrae in a joint called the costovertebral joints. And those joints are very mobile. And when anything's mobile, they have the opportunity to get stuck, right? So a lot of times what happens is when you said they flare out a little bit, it throws off the biomechanics of that area. And inflammation can ensue and whatnot. So what our approach is it's very simple. We're just trying the same approach we have with the pelvis and the sacrum. We're just trying to find a way to mobilize those joints. When it really poses a problem in pregnancy is a lot of times, especially in the lower rib cage, like on Joe Schmo who walks in with rib problems, I'll just lay him face down on the table and adjust him that way. Because those ribs are so low, we're not able to do that with mom. So we utilize what we call an A to P adjustment. So A to P means anterior to posterior or front to back, where mom's actually laying backwards on the table, face up. She's kind of giving herself a hug. And it's just a nice, gentle kind of push down. And a lot of times there'll be a large degree of a movement that occurs with that adjustment, and which makes mom very happy.
Of course. Oh, I bet. Oh, it feels so good.
Yeah.
And if we were talking about like that mid-scapular pain and that thoracic tightness, so the fact that the ribs don't have that range of motion and that they're flaring out and they're in a different position to make room for baby can also contribute to that like mid-back pain.
Yeah, absolutely.
Right?
So mid-back pain is huge because you have to think about what's going on with the body, right? And like we were talking about on the phone the other day, Carly, like you're pregnant, like your Facebook friends probably know you're pregnant, but your brain, some parts of your brain don't understand that you're pregnant. They just know that your center of gravity is shifting forward. So like the part of your body the part of your brain that's responsible for understanding and interpreting your center of gravity, as you start to grow forward, little by little each day, that center of gravity is shifting forward and the brain's going, what the heck is going on? And it just kind of squeezes those low back muscles, which can cause a lot of discomfort and whatnot. And that works itself right up the chain into that, mid-back and whatnot. And we start to lose that mid-back mobility that's so integral to spinal biomechanics. Like, I think a lot of, especially in like our culture, a lot of low back pain, neck pain, shoulder pain can all be attributed to that mid-back those mid-back fixations that we develop doing the things we're doing right now, hunched over our laptops. And
yeah, exactly. do as I say, not as I do.
Exactly. Yeah. As I sit up.
With that being said, same thing, cavewoman brain. Like our bodies are smart. We're gonna do what's easiest. So what I often find, and like I see a lot of my mamas postpartum, and they're like, so sometimes I'll see them for the first time after baby number 3 when they're, dysfunction is more prevalent, it's more obvious to them. And they always go to me, they're like, I wish I knew you during my, after my first baby. And I'm like, I wish I got my hands on you before you became pregnant with baby number 1 or when you were pregnant with baby number 1,
Yeah.
Because yes, we're going to do what's easy. So center of gravity is going forward, right? The belly tissue has to move forward. We're going to get into diastasis. I love it.
That's your
so the tissue's moving forward. So where do we find our mamas? They start really getting lordotic, which means like twitchy out posture because they're just hanging on the joints. They're not really using their muscles because it's harder. this develops diastasis, like I said, we'll get into, and also their glutes often shut off.
Yeah.
You know what I mean? So they're relying on the joints of the back, which can cause pain and restriction. The muscles along the spine are guarded and tight, right? And then, you know, one of my biggest goals, if I have my mama who's pregnant, who is carrying, like she's showing, maybe she's second, third trimester, is being able to find that deep core, being able to find your glute muscles when you're standing. So it's less pressure on the back and less pressure on the spine, so that we don't get those restrictions and we don't get that guarding. And it's really, when I see them during pregnancy and then postpartum, and we've found, you know, all these strategies during pregnancy, like the rehab process is so much simpler because they've already really made that connection. So it's not such a shock to the system when all of a sudden you have baby and your center of gravity is shifting back and you're like, oh my gosh, how do I find these muscles?
Yeah. And I think just like you and I both know, just in our fields and our expertise, like the patients who take that proactive mindset are always better off long term, you know?
Yeah.
So we preach proactive, not reactive. And I think that's no different, you know, with what you do or what I do. You know, if you can get out in front of a problem, it's going to be a heck of a lot easier to deal with that problem than waiting for it to manifest itself into, you know, low back pain, sciatica, diastasis. I always say diastasis.
Honestly, it's potato. Diastasis.
Ceasus, you know, same thing.
Exactly. We just can't decide.
Yeah.
So to touch on the diastasis, the diastasis is when you have your six-pack muscle in the front, right? And you have this fascial tissue in between called the linea alba. It is not muscle. So once it stretches, that's about it. Okay. More research has shown that like all mamas, first time mamas, second time, third time, the severity gets, you know, increased with the more kids that you have. But in the third trimester, there has to be some degree of separation to make room for baby. The problem happens when the core is not firing appropriately, or we still have like severe separation like 2 months out. So like we talked about, that low back is getting super, super lordotic. The tissues are getting tight back there. Tissue is stretching forward. Maybe our core is not as easy to find when we're pregnant. We talked about we're relying on those joints, okay? So often, so with that split, it's really about finding that core strength, not only of the obliques, the rectus bellies, but really like the winner, the transversus abdominis. It's like that deep corset muscle. Hardwired.
We talk transverse, all the time.
Oh my God. If you can find this one, it's money. And it's hardwired to the pelvic floor. So they kind of like are best buds, essentially.
It's good to know.
So if that transversus is working and you can create tension underneath that split of the rectus bellies, of the six-pack muscle, your odds of developing incontinence or prolapse, if you have that support in your abdominal cavity, is like really a lot less.
That makes plenty of sense.
Yeah.
I mean, I think those two things that you just said were exactly like what I think most of my moms are like fearful of, right? Like the diastasis and the and the incontinence are too big. Like if I was to, you know, sit down a first time mom, like, you know, in the first trimester and be like, hey, what are you fearful of after giving birth? Like, what changes to your body are you worried about? I think those would be like kind of big too, right? Yeah. So I think that's huge what you just said, and just to be able to kind of get out in front of those things and be proactive with problem, you know, or with potential situations like that, you know, and kind of reduce your chances of that happening, right? Because you can never prevent it 100%, but I'm sure there are ways that you can, you know, put the odds more in your favor.
Absolutely. Yeah. And, you know, with that being said, sometimes that diastasis, like you can train that core until you're blue in the face, but if you have real muscular restriction, which is my bread and butter, if you have really a lot of tightness in those paraspinals, in the low back, that's kind of like, think of it like cinching, like it's cinching back. So even if you have that control, even if you have, like you can find that deep core, but it has nowhere to go, it's not going to close, we can't close that gap. So sometimes it's a matter of manual techniques to release those tissues, both the fascia, the superficial stuff, and the muscles, so that when this is nice and loose in the back, now I'm going to find my core contraction. Now I have somewhere to go and I can close that gap and I can create tension. That's the name of the game. And think about it too, like these women, you know, we talk about the 6-week wait, and I do the same thing. I want the OB clearance. I want to make sure everything's good. The uterus is healing. No matter how good to plan or maybe traumatic or not to plan your birth was, it's trauma to the body. You need that time to heal. Your uterus needs that time to heal, and the cervix to close up.
I'm glad you used that word. trauma.
Yeah,
Because
absolutely.
it is trauma, and it's trauma to mom, and people don't realize too, it's trauma to baby as well,
Absolutely.
and so it's important to also get, baby checked as well,
Absolutely.
especially upper cervical spine.
Yeah. Ooh, can you talk about newborn,
I would love
like
to.
adjustment, chiropractic,
Yeah,
like all
so
of this good stuff?
this is like everyone's like, oh my God, you bring your baby to a chiropractor? Like, because like, in people's minds, their chiropractor is like popping or clicking, right? Like we don't pop or click a baby's joint at all.
Right.
The baby's ligaments are so, lax, and the joints are just so willing to move. It's like, I don't know if you can see my hand maybe here. It's like this much pressure on the baby. You know what I mean?
Right.
It's like in order to achieve the adjustment that we need to achieve. Um, and that's really it. Like when my daughter was born, as soon as grandma, grandpa, everyone left the room, the first thing I did was make sure her neck was all right and it was in a good position. And we're primarily just checking, right below the skull there, because if you think about the amount of, first off, they're fitting a big head through a tiny hole, right? That
Right.
can't be good for the neck. And then, you think about the amount of force required sometimes, if they have to use a vacuum or the forceps or,
Yeah.
even just like that pulling, where are they pulling? It's right behind at the base of the skull there. So it does cause a lot of fixation that can lead to things down the line, like, ear infections and chronic ear infections, maybe some,
That's so interesting to me. Like a
some
chiropractic
torticollis.
adjustment and tapping into the parasympathetic like nervous system, like the chilling at the beach, everything's okay. How
Sure.
this effect can decrease ear infections. I don't know I don't know the research. I don't know
So
if
I
anybody's.
actually this is what I did my senior dissertation at in
Yes.
chiropractic school. So I know a
Awesome.
decent amount about chiropractic and ear infections, and kind of the main thing, that the really main take home point is I think in my mind it boils back down to the biomechanics. So there's actually muscle fibers and just kind of soft tissue fibers. I won't call them muscle fibers, that kind of have in common with the upper cervical spine. So C1, right, the atlas, it
Mm-hmm.
shares fibers with the jaw and the eustachian tube in the ear. So the idea is if there's any fixation in that upper cervical spine, right, and
Mm-hmm.
it's causing tension on those fibers that go to those two different places, it might affect the function of the eustachian tube. Does that make sense? So
Yeah.
like
No. This is.
so so if the eustachian tube is not functioning properly, it's not able to rid the ear of all the stuff that gets in it and whatnot. It's not able to function the way it's designed to function.
Yeah.
And then maybe baby gets ear infection, and they give antibiotics, the ear infection, the bacteria in that ear goes away, but then it just starts happening again because the eustachian tube's not functioning properly. You
So
see
we're
what I'm
not getting
saying?
to the root of the problem.
Yeah.
It's maybe
And
not in the right position, or it has these restrictions because of restrictions at the spine. Or is it true the TMJ as well? Did you say?
TMJ as well, but we don't touch the TMJ.
Okay.
It's too much of a fragile joint at that age. It's not something we do. And I want to be very clear: this is not a cure-all for ear infections by any means.
Right.
But there is a very high failure rate of the antibiotics with the ear infections
Mm-hmm.
and chronic ear infections that lead to the ear tubing. I forget the name of
Mm-hmm.
the exact procedure, but so my kind of philosophy behind this is, let's make sure it isn't just a mechanical problem before we start going the drugs and surgery route. So let's clear the
Preach.
upper,
Yes.
right? Let's clear the mechanical issue, and if ear infections keep happening, then you go that route. You know what I
Yeah.
mean? So like, it's just like, we could go down this whole philosophical conversation about portal of
Down the
entry
rabbit
and
hole, but
whatnot.
I love
Yeah,
those
but
rabbit holes. I know. I know.
yeah. So I think that's very important to understand. And if you find a good practitioner like you and I who know where their care needs to end and it needs to be referred out,
Yeah.
I think that's a good place to be. So someone just commented, so I wish I knew about this when my son had 4. Yeah, I mean, and for 4 ear infections in 6 months, that's not fun, and
No.
especially when they're young and they can't tell you what's hurting them, and you're
Yeah.
playing the guessing game, or in the middle of COVID and they're spiking fevers and you're freaking out, right?
Of course.
So
And this is a friend of mine who's a physical therapist, and this is honestly the first time I'm hearing this too. So like I'm super amazed.
Flabbergasted.
It is mind blown. I love this. That's
Yeah,
so
it's just
great.
and it's just such a simple thing, and I think that's our approach with just about every joint in the body is like, hey, when the joints are designed to move, when they
Hmm.
stop moving, they become a problem, and
Yeah.
um, I think that's really it. Whether it be the pelvis and the sacrum, or the upper cervical spine and pelvis, sacrum, and mom, which can help with push time and things like that, and
Absolutely.
and and upper cervical spine
Yeah.
with baby.
At the end of the day, what we do, physical therapists are musculoskeletal experts. You know what I mean? And you guys are just G's as far as alignment and, chiropractic physicians making sure that everything is where it's supposed to be. At the end
Yeah,
of the day, everything comes down to neuro, right? So for both baby and mom
yeah,
or
100%.
Partum, you know, I'm sure that you find this trend where after they're coming for these adjustments, and helping them get into these more relaxed states or
Ah,
getting out of this fight or flight panic mode that maybe they were in during labor or pushing. Like we said, it always comes back to no matter how to plan or not to plan your birth was, it's trauma. So get in to your to your chiropractor,
yeah,
get into Waldwick Family Chiropractic. That's awesome. I wanted
yeah.
to touch on one more thing that I thought of.
Please, yeah.
Do you see recurrent low back pain in your new mamas? Like, how often do we favor one hip? You know what I mean? Like, moms are
Oh,
notorious multitaskers. So maybe they're doing one thing with one hand and then they have their baby propped on the other side.
yeah, hook this way, and then they got the phone over here. I'm
Exactly.
like, look, I'm
Exactly.
standing straight. Like, no, you're not. Yeah,
Exactly. So what's your
but
recommendation
that's not
for,
just moms. That's everybody. Let's
that's
be
true.
clear with that. So,
Absolutely.
um, yeah. So I think like just to kind of walk you through. Sorry, the dog's not happy that my wife just went on a walk here. Lola, chill. Sorry. So when we assess, hold on one second. Let me just let
It's
her
okay.
in
It's
here.
okay.
Take you with me. So, Lola, you're gonna make an appearance here. Say hi.
Hey, hi, you're so cute. Dalmatian?
Yeah, we've got
Oh
a
my
Dalmatian. She's a
God.
sweetheart.
I love
So
her.
when we lay mom down on the table, what we're looking for is pelvic fixations, right? And we're looking to see the first thing I usually look at is the leg length, right? So I'm sure this is a big question you get all the time. And this is one of my biggest pet peeves with my own profession, the chiropractic profession, is like, we'll say some chiropractors will be like, oh, your one leg is shorter than the other, right? And there's two types of short legs. There's an anatomical short leg, which means one bone is actually shorter than the other, or there's a functional short leg, and what that means is it's the result of a lot of pelvic, rotation and fixations and whatnot. So when we see that short leg, the first thing we'll ask mom is, have you ever broken your bones, or have you ever had surgery on your hips or your knees or your ankles? If they say no, then we know we're dealing functional, right? So the problem is not in the leg, it's more in the pelvis, right?
Mm-hmm.
So if you keep in mind, the hip joint attaches to the pelvis. So when the pelvis rotates, it pulls the hip upwards, right? So what we're looking for is that leg length, and we're looking to correct that leg length, okay? So we'll lay the mom down, we'll look at that leg length, and that'll cue us in on how the pelvis is fixated, right?
Mm-hmm.
So usually what we'll use on moms is if we can get them face down, we'll use what's called the Thompson drop technique. And if you guys are interested or like curious about chiropractic care, I've done 3 YouTube videos, one for trimester 1, one for trimester 2, one for
Love
trimester 3. They're in
Awesome.
a blog. I could send you the blog, Carly, if you
Yeah,
want to
that'd be
like
great.
send that to your following. All
Absolutely.
centralized in that. But what it is they're laying down and the table's doing most of the work. It's just a quick kind of jolt to kind of ease the pelvis in the right direction. You really don't. My patients are usually like, why are you even doing this to me? This doesn't do anything, right? So I think just to kind of debunk that short leg thing, and what that does is to it frees up when we restore that leg length and equality. What we're looking at is we're looking at a neutral pelvis, right? So
Right.
when the pelvis is in neutral, it's when, like I say, game day comes and it's time to expand. It's the body's not working against any fixations that come from those things that you're talking about, like sitting with your, on one side, or crossing your leg. The most common leg length or pelvic rotation causers in my mind are in men, it's keeping your wallet in your back pocket,
Oh,
and
yeah, that's a big one.
women, it's sitting with your legs crossed.
Right.
I think those are the two
Yeah.
big contributors.
Yeah. So often with my mom, is the conversation is, start to pay attention. Do you favor the one side? Maybe you can do make sure that you're sharing the load on the other side, right? So it's not in
Yeah.
between. Or if your baby's small enough and you're doing, baby wearing, if you have two hands available for baby, like holding them more centered and really finding your core. So that same idea, if you're holding the baby centered, your center of gravity is forward. Don't just rely on the joints. Find that deep core, hold baby in, keep your spine neutral, and support yourself. But like any little modifications that we can make, you know what I mean? Ooh,
100%.
yeah. Back to the breastfeeding and mama
Yeah.
shoulder and tight thoracic.
Well, I think it kind of all falls in this same category of just little changes to the posture, really go a long way. And,
Yeah.
it's easy to remember this at 10:30 in the morning on a Wednesday when, you're engaged in Instagram Live, but it's very hard to remember these things when it's 3 in the morning and you haven't slept and, it's your third feeding in the past, 5 hours. Like,
Yeah.
any parent knows what that's like. So what I tell my patients with anything postural related is set yourself up with little cues to remember. Maybe it's setting a little stuffed animal on so you could see it where you usually feed your baby. And when you see that stuffed animal, it's a reminder, okay, sit up straight. Like these little visual cues, just these little things to help remind you. Maybe it's sliding a pillow behind your low back in the chair that you're feeding in. Not necessarily for support, but just as a reminder that you don't want to slouched over like this. You want to be sitting up and engaging, like you said, your core and whatnot.
And you don't want to be tight and tense and your neck and your shoulders up here. Think of someone who's super stressed out.
That's
Maybe comes into the office, shoulders up here, clenching their teeth. Like you should be able to relax. And my biggest thing always is, don't go down to baby and slump here. Bring it to you. So two of my favorite products are the My Breast Friend or a boppy, or like if you don't want to get anything fancy, just get some pillows so that baby is closer to boob. So that you're not here, you're allowed to like relax and be back and just like take a breather, right? So bring baby 100%. To you. Get your neck and your upper back checked out by Dr. Seuss.
And also switch arms too.
Yeah.
You know what I mean? Like if you're always here, like try the other way. Give yourself some. I mean, I don't know like the mom science behind it, but from a chiropractor and a biomechanical standpoint, like that's what I always tell my patients is like, if you find yourself favoring one side all the time, of course you're going to have problems on that side. So if you can make little things to kind of help balance that out, you're
especially
just going to set
if you're
yourself
bottle
up.
feeding. To remember, this was the coolest thing. A friend of mine was breastfeeding, and she kept switching her wedding ring back and forth, or whatever ring that she had. And so she would feed.
That's a really good idea.
Switch the ring, and I'm like, oh, that's so interesting. Why do you do that? She goes, so I remember which boob to start on next. So I think it's great, especially for mamas who are doing bottle feeding. If they're
that's
not
good.
if they're not
all about visual cues. Yep.
I know.
I'm all about that.
Make life simple, right? Like keep it simple, stupid. Like let's make it easier. You have enough to think about. You have enough to do. So little hacks like that, just to remind you. Okay, I fed on this side the last time. Bottle. Let's let the left do the work. Same idea with the hip. I was favoring that right hip. Maybe I'm right side dominant. Let's try the other side and just trying to even out that obliquity and that uneven.
Sure.
Use your total. Being a new mom, new dad, it's like total body workout, right?
Yeah. Yeah, exactly.
Especially 100%. If you're chasing around a toddler at the same time.
And it's like these little annoying muscles you're working out. It's not like the big ones. It's not the beach muscles you're working out. You know what I mean?
It's like that way. It's all good.
But yeah, so I think just to kind of talk a little bit about myth busting, like you talked about before, I think one of the big negative kind of views of chiropractic care in society is once you go, you have to go 3 times a week for the rest of your life, right? Like they're going to try to rope you in like a used car salesman. Like that's not how we do things. What we usually recommend as far as frequency for our pregnancy wellness patients, so somebody who's coming in not for low back pain, not for sciatica, just because they're interested in making sure that their pelvis is moving properly to get ready, for childbirth, is just lining your visits up with your OB visits. So if you're seeing your OB once a month, then you should be seeing me once a month. When they increase your frequency to biweekly, you're seeing me biweekly. And in the last couple of weeks before childbirth, you're in here once a week. So, as long as you're not in pain, don't get me wrong, there are times where, mom has sciatica and we have to get her on a 3-week care plan of 2 times a week or 3 times a week, right? But that's a short-term thing. It's not like, we're not trying to rope you into some lifetime 3 times a week contracts. You know what I mean?
Exactly.
Which some chiropractors do, and that's unfortunate for the profession as a whole, so.
Absolutely. Yeah, if my moms are relatively asymptomatic, in my perfect little world, I would see them at least, like say pregnancy is going smooth, there's, you know, not a lot of pain, not a lot of issues. At least I'm checking in with them once a month to see, or, you know, at the least once a trimester. In my perfect world, once a month, but just to see what's going on, you know, educate them on different, you know, strategies and tools and finding their core, making sure their glutes are nice and strong throughout pregnancy.
Sure.
Seeing exercise wise what they were doing. Oh, this is what I was getting into that I got a little sidetracked. So
Sorry if I cut you off too.
No, it's okay. You know what? There's so much we want to get through that sometimes
I
know. Forget. You didn't cut me off. Weight training or exercising during pregnancy and how it affects labor time and pain and health for both baby and mom, super important. And it's just not realistic to tell mom to be on bed rest or to be chilling or anything like that. Because think about those appointments after. Like say you already have children at home that you're chasing around. You have a 2-year-old toddler that, you know, you're picking up and you're dressing, you're getting ready for the day, what have you. Baby comes, right? And you have a diaper bag, you have a carrier, you are pushing a stroller, you know what I mean? You're holding baby, you're lifting baby in and out of the crib, how many times? So like, let's functionally train, let's weight train through pregnancy,
100%.
postpartum, you know, I think the outcomes are just so vastly different.
So this is a good kind of your ballpark, because, you know, sometimes I do deflect this question to the OB. So when they say, you know, what can I be doing during pregnancy? So as far as weight training go, and I know we were always taught like whatever they were doing before pregnancy, they can continue throughout pregnancy.
Right.
But that's really the extent of my knowledge on that. And that's usually what I say. And I say, make sure you run that question by our OBGYN. So go ahead and educate me if you don't mind.
Yeah, absolutely. Yes, I'm like, listen, before any exercise program, clear with your OB. Everyone is super individual. If somebody, you know, was more of a yogi, like pregnancy is not the time to train for a marathon.
No.
But if you were a runner before, if you're weightlifting before, I think she's actually on here. I have a girlfriend who has been doing interval training, weightlifting. She's
a badass.
34 weeks pregnant and she's just fabulous. You know what I mean? And
Yeah.
I really think the outcomes for her and baby are going to be so great.
Yeah. She's going to be she's going to be ready to roll.
Like, exactly. So it is so individual. That's something that I love to guide my mamas through. If you feel like you're straining or pushing, or if you're leaking or wetting yourself and you don't have that coordination of your deep core, of your pelvic floor, that's a time to talk to a pelvic PT during pregnancy, postpartum, what have you. If it's causing pain, you know, it's often, and this is even in my patients who are not pregnant or postpartum, is a game of listening to your body, knowing when something's a little bit too much for you or is causing pain, finding out the root of it. Why is it happening? Is it weakness? Is it obliquity, like one side over the other, whether it's like one side's too tight, one side's too weak? Is it how we're lifting, how we're breathing, how we're recruiting our deep core and supporting ourselves? Are we valsalvating and lifting like a weightlifter? I can go down this rabbit hole forever.
Me too, yeah. Or core activation and the intra-abdominal pressure. Yeah, I could talk about that all day.
But to keep it safe, whatever you were doing before pregnancy, like rock on with your bad self until something gets, you know, until your body's like, wait, I don't know how cool I am with this. And then make sure, like if you're going to a trainer or someone, or if you have a pelvic PT, you know, guiding you through finding modifications so that you still feel like you're getting your workout in and you still feel, you know, happy and healthy and you're getting your endorphins flowing, but in a safer, more effective way.
And I think also, like, don't be afraid to ask questions, right? Like you have these resources, like, you know, you've got Carly, you've got me, you know, shoot us an Instagram message and be like, hey, what do you think about, and, you know, it might not be something we're comfortable answering over Instagram Messenger, but, you know, at least we can point you in the right direction. Like, oh, maybe that's something you should run by your PT, or come in, we'll address that. You know, we could do that right in our office, you know, so don't be afraid to reach out, you know, on that as well. Carly, I do have a couple submitted questions from, this is my second time bringing up my cousin, Jamie. I hope she doesn't mind.
Hey, Jamie!
But I don't know if she's watching, but I'm sure she will later when we post it. She wants to know, what does a typical therapy regimen look like with you?
This is what's beautiful too. You were saying where your treatment plan, you're not trying to rope people into 3 times a week, you know, for the rest of their lives. And honestly, I'm not either. I do a hybrid model, which means I started cash-based with COVID. I am going through the process of going through insurance to ease the burden for my mamas, but that's a whole other story. But the beauty of this is we have that flexibility if we're going outside of insurance, where sometimes I see my mamas, it can be every other week. In my perfect world, like if something's really going on, it might be once or twice a week. You know, it's super individual. It depends what's going on. But my goal, and my good friend Katie, who has a similar business down in Florida, she's fabulous. We always have this conversation, and I think, you know, if we're seeing our mamas, like maybe I'm seeing them on average anywhere between like 4 to 8 sessions, spread out however works for them, right? Moms are busy.
Yeah.
So that's really the premise of my business was, let me come to you. Let's do it on
That's
your
what I
schedule.
wanted you to say. Yeah.
Yeah.
I think that's huge, man. Like, especially like, I mean, I've never been to pelvic floor and OBGYN, right? But, you know, I can imagine it's not the most comfortable, you know, place to be,
Yeah.
you know, feeling exposed and whatnot. So,
Yeah.
you know, the fact that you're willing to go to them, go to mom, I think that
Yeah.
sets you apart from like,
Thanks.
you know, from like, I think that business model is a home run, man. And I think,
yeah.
Go ahead.
No, and the biggest thing is like,
Yeah.
I was super inspired on like for multiple reasons by one of my patients. I was in a busy outpatient orthopedic setting, and I loved it. And it was multidisciplinary. I was working with an acupuncturist, chiropractors, you name it, and it was awesome. But I had a mom coming in who was a mom of 6.
Jeez.
Saw her, yeah. So like her figuring out, like getting the kids in the car, packing them up.
Yeah, it's a vacation.
Finding babysitting. Yeah, absolutely. Finding babysitting. She was always, and I mean, poor thing, she was always like 15, 20 minutes late. And I don't blame her.
Yeah.
But then like by the time she got in and we caught up, it's almost like we were halfway through her session. And I was like, oh my gosh. So in my brain, I was like, how can I do this around her schedule? Like most of my patients I'm seeing during their kids' nap times. They're like, okay, 12 o'clock, the kid's going to be asleep. It's me time. Let's go. And I'm like, that's so
dude,
awesome.
Home run.
Because moms, I mean, we know this. Like, moms will do anything for their kids, like anything for their family.
Yeah.
But I think sometimes when it comes to themselves, they put themselves in the backseat. They're like, I'll deal with it later.
Yeah, you can't pour from an empty cup. Yep. You have to.
That is my favorite phrase ever. That is my favorite phrase ever.
So you got to make sure you, you know, take care of yourself and prioritize mom, because, you know, you're not going to have that energy to give.
100%.
The energy you want to give to your kids won't be there because, you know, you'll be drained physically, mentally, emotionally.
100%. Right. And there's such a huge, I always have to touch on this. There's such a huge correlation with incontinence, leaking, whether it's urge, you just can't make it to the bathroom, or when you're working out, sneezing, coughing, laughing. There's such a correlation with that incontinence and perinatal postpartum depression. Okay. So talk about mentally being
huge.
There
for, okay. I'm glad you talked about
being there mentally and physically for your family. And then you're having this struggle. You feel like you've lost control of your bladder. It can be super.
It's like you feel like you're not yourself anymore. You know, who am I? I'm, you know, so that's a very good point that I'm glad I never even thought about that. And
absolutely.
It totally makes sense.
Yeah. So PSA, moms, take care of yourself.
Yeah.
Get seen before there's even a problem or any pain, both from a chiropractic standpoint and pelvic PT, physical therapy standpoint. We're probably wrapping up soon, but Jess, is there anything else that you wanted to PSA?
Well, I'm just happy. I've been wanting to do these Instagram lives for a while, but I guess I've never had the cojones to do them. So I'm glad you let me be the first.
Yeah,
so
absolutely.
This is my first, I should say. You've done a few, but this was a lot of fun.
When I get it the first one, I was like, oh my gosh, Katie. I was like, you know, God forbid I let a 4-letter word slip. I am from Jersey.
Oh, it's totally, no, that's just ingrained in us.
It's so great. It's so fun. And I really love connecting with like people in the community, you know, yourself,
100%,
especially who work with moms, who help moms heal, who make them feel better. Happy wife, happy life, happy moms, happy everyone.
You got that right. Yeah.
So, yeah, you know. So big believer in that. But yeah, I think, you know, unless you have anything to add, I think that's all we got for you today.
No, I think that's really it. I think maybe what I'll do is I'll send you the link to that blog that we put together for moms, and maybe you could send that out to anybody who may be interested. And feel free to send over anything, any literature, anything like that we can, you know, put together in an email or a post or something along those lines.
Thank you so much for your time. Thank you.
My pleasure.
For joining
Thank you. This was a lot of fun.
Yeah, absolutely. And have a good rest of your week, okay?
Yeah, you too. Say bye-bye, Lola.
Thank you. So
Take care.
Bye.